if somebody comes in and they're new, they're not from the area, we look at their address and the address is another part of town or the doctor's in a different part of town, that's when we would utilize the PNP. And we would, typically we'll go to the back computer and look it up, find out our information, call the doctor if we need to, call the doctor before we ever finish filling the prescription. If the doctor's aware of it and they tell us, yes, it's okay, gives us a reason, to be comfortable with it, then we'll fill the prescription. Or if it's a doctor we know, from a different part of town that has issues, or if somebody calls us up and asks if we have a drug and then, they show up 30 minutes later and it's from another part of town, then we're more suspicious. And that's when we would use the PNP. We're getting more and more phone calls, so we're saying no on the phone a lot more. If they come in and we find something, it might be 1 a month or 2 a month. It's not as common, but we are turning them away before they ever get here. So that we'd rather them not show up. Right, we have a point of sale system that we have to store driver's license in our system. So when they come to check it out or when somebody else comes to pick it up for them, then we have both driver's licenses into the system and it automatically, within that 5-minute time frame, has been sent to the Bureau of Narcotics. And once we check somebody out, then within 5 minutes, it's a live system. So it is going straight into the database. So if they take a prescription from our pharmacy and 30 minutes later they're filling a prescription at another pharmacy, it's going to show up if somebody else is going to look at the PNP or vice versa. In years past, it was a 2-week lag time because we would send it every 2 weeks or every 10 days it would send through. And so there was that lag, so it might be filled for the same medication 3 times in a week and us not know it. So now it's in there and set. It's a hard position to be in because we're up against the doctors and you don't always know their situations, especially when you're just looking at a prescription. You could have somebody who's a post-polio syndrome and they look okay, but they're hurting on the inside. Or it's somebody who's been in the military and they've had a war injury and you don't know that. And so it's a hard call because you don't want to be insensitive to what's going on with them, but you also don't want to put the medications in the wrong hands.